These are the shoulder cane exercises. There's a series of exercises for this one. So we're going to start with the most basic, working on shoulder flexion. So if you have pain and you are going to do what we call active assist range of motion, it might be painful for you to get your arm overhead actively as I'm doing now. You might use the assistance of a cane or something else. So I'm using a little pole here. You can use a cane, anything, a dowel rod, anything like that that's solid. Broomstick would also work. But this is you're going to use the assistance of your other arm. So in this case, I'm going to pretend like my right arm I have a hard time raising overhead. So I'm going to use the assistance of my left arm and the stick to help work on my range of motion. So this is supine flexion with the cane. So you're going to lay down on a bed or a table. You're going to start with your hands about shoulder width apart. Once again, knees bent up is probably going to be the most comfortable. You're going to start with your arms straight. In this case, as I said, my right arm is the arm that is injured. So my left arm is going to be doing most of the work to help control and pull my right arm up overhead. You're going to go as far as you can, wherever that might be. You may only be able to get this far. You're going to hold for 3 to 5 seconds for a little stretch. And on the way down, you're also going to assist with your good side all the way down. Sometimes coming down is more difficult or painful than going up. So make sure you're using your good arm to assist with doing that. One key thing to watch out for is as you're doing this exercise, especially on coming back down, but also coming up, it's common for people to hike their shoulder up to protect it or to compensate towards the ear. So make sure that you're keeping your shoulders down and back against the bed or the table as you're doing this exercise. So that is overhead flexion. The next exercise is as things get a little bit easier and you can lay down and get all the way up and over, you can also do this exercise in sitting. Makes it a little bit more difficult as you're adding gravity in, but it's the same exact technique. You're going to hold on to the bar and you're going to go up and over using your good hand to assist going up. Some people like to hold onto the stick, and instead of going up this way, you can have a little bit more support and push your arm up going like this. So there's 2 different ways of doing that exercise. Both are fine to do, whatever's most comfortable. You're basically just going to grab onto the end. I like to put my hand here. Some people like to hold on like so. But you're just going to gently use your good arm, in this case my left, to help push your involved side up and get a good stretch as far as you can. So those are the progression for overhead flexion. Now we're going to work on abduction, or going out to the side. So you're going to use that same technique that I just did with going forward, but you're going to do that going out to the side. So you might need a little bit longer stick depending on how high you're getting. Sometimes this is a little bit short for me, but once again, I like to put my hand on the end. Some people like to hold their palm up as they go up and out to the side. But once again, you're gently pushing up, getting a good stretch as far as that can be, and then come back down. Watching out for compensation of shoulder elevation. So that would look like if I were doing this and my shoulders popping up towards my ear as I'm doing this. So this is not appropriate. What you want to do is keep that shoulder down as you're coming up. So you can see the distance between my shoulder and ear with this exercise versus this. Okay? So that is both shoulder flexion and shoulder abduction with a cane.